Welcome to the Well-Being Manifesto Podcast, where we translate science and experience into realistic and sustainable ways of living. In each episode, we offer clear and practical strategies to support all aspects of well-being that matter to you, whether in your home, your community, or place of work. The Well-Being Manifesto is hosted by Dr. Moain Dabrh and Dr. David Freeman, who have spent their careers advancing whole person care. Join us as we focus on real lives and real change, with less hype, more truth, better living.
Hello, one and all. Welcome to the Well-Being Manifesto Podcast. I am Moain Dabrh.
And I'm David Freeman. Today, we're honored to welcome one of the world's most visionary physician scientists, Dr. Eric Topol, cardiologist, geneticist, and digital medicine pioneer. Dr. Topol is the founder and director of the Scripps Research Translational Institute, author of transformative works such as The Creative Destruction of Medicine, Deep Medicine, and more recently his book, Super Agers. He is one of the most influential voices in the intersection of technology, genomics, and human longevity. His latest book, Super Agers, takes us in a deep dive into what determines not only how long we live, our lifespan, but also how well we live, our health span. From his insights on nutrition, exercise, sleep, microbiome science to cutting-edge applications of artificial intelligence and genomics, Super Agers is a masterclass in how biology, lifestyle, technology are converging to redefine human aging.
Welcome to the show, Dr. Topol.
Thank you. It's great to be with you both.
So, your book, Super Agers, is filled with evidence and notes from practice and up-to-date evidence-based approach to longevity. When you opened the book, you opened it with the idea that every human desires to live long, but no one would like to be old. This speaks kind of to the concepts of health span and lifespan. So if you could just educate our audience a little bit about that, and how do you define super agers?
Yeah, well, maybe I can start with the super agers. I would consider people who are over 85 years old, who've never had cancer, cardiovascular disease, or neurodegenerative disease, the big three age-related diseases, to be qualified as super agers. So that seems to be a very laudable, attainable goal. And all this fixation on living to 110, but being frail, demented, or crippled, or whatever, that doesn't seem to be what we should be driving our efforts at, because living long but not healthy isn't really great. But I do think we can extend health span, and that's why I wrote the book Super Agers. I think learning from people like the patient I presented, Lee Rusall, this is LR in the book, who is 98, patient of mine, who's totally intact. We can learn from her and our elderly that we studied, 1,400 people like her, where we did whole genome sequencing. And it's not in the genome largely. It's mainly things that are in our lifestyle and our immune system, which are interrelated, of course. So I'm enamored with the ability of our and extending health span in the years ahead, and many more of us becoming super agers than are currently the elderly, that people 65 and older that have multiple chronic diseases related to aging primarily.
It sounds like this speaks to, eventually, it's the quality of life that we have for how long we live it. It's not just the length of it.
Absolutely. And we can isolate these three diseases as accounting for most of that deterioration. I mean, we're all going to have some musculoskeletal joint osteoarthritis and other things, but these big three account for the most important reduction of health span that we can concentrate on. And I do believe we have new capabilities to prevent these diseases. We've never done this seriously in the past. We didn't have the way to really get on it.
And Dr. Topol, as a physician, I thoroughly enjoyed reading your book. And in the work, you talk about that health span is somewhat malleable and often more often influenced by lifestyle than genetics. Knowing what's in your book, what do you think was the most surprising findings in that regard?
Well, there are many, but I think the one that we took away from that Welderly study, which was the genomes of these people. I like to call them Welderly, but we use Super Agers because the publisher, Simon & Schuster, didn't think anybody would know what Welderly meant. So anyway, they didn't have much in their genomes that was different from the elderly, which is surprising, and other control groups. So I do think there is some heritable features of health span, but largely it's not in our genes, or at least in our whole genome sequences, if you want to use that accurate anchor. On the other hand, lifestyle is really important. So that gave me a kind of liberated sense, because I have a terrible family history. And I think many people who listen to your podcast are in the same group as me. And the fact that you could feel better about your own taking control of lifestyle and other ways to understand your risk and prevent diseases, that gives a kind of new hope. And this fatalistic thing that, I've had, bad genes, if you will. Well, turns out it's the immune system that's really the biggest determinant of our health span. And in many ways, we can get our immune system, keep it intact, and prevent this so-called, as you know, the term immunosenescence and inflammaging. These two processes really do account for these big three age-related diseases.
So talking about these factors in, genetics versus epigenetics, the environment, as well as lifestyle, we refer to the lifestyle components as the lifestyle meds, mind, exercise, dietary habits, and sleep. And often researchers or anyone who's talking about one of these big four or categories of life habits and lifestyle habits, they often tend to say, well, this eating is the single most powerful, or exercise, or this or that. When you are describing the current data, what does the data tell us? What do the data tell us about the bigger picture when it comes to health span and lifespan?
Yeah, so in the book, I use the term lifestyle plus factors. Because I think they're even broader than what you mentioned. And they include the things you said, but also many others, like, for example, social engagement, being out in nature, avoidance of these toxins like air pollution, forever chemicals, microplastics and nanoplastics, certain ultra-processed foods. So, there are many factors that are either promoting inflammation in our body or getting our immune system to be dysfunctional, dysregulated, if you will. So that's really the things that, at least some of them, we can control. We can control how we sleep, how we exercise, what we eat, to a large degree. We can't necessarily control air pollution, and we can reduce perhaps the plastics. But, there's certain elements within this lifestyle plus that are critical, all, I think, working primarily through the immune system and inflammation, that we have a ability to modulate to keep us healthy. And in fact, I cited in the book many studies that show that if you start at age 50 and you bear down on all these factors, that it gives you 7 to 10 years added healthy aging. That's pretty good. If you start even younger than age 50, obviously you'll get even more. So it's never too late to get serious about these lifestyle plus factors.
It's never too late. And it's also the amount of changes is never too trivial, because often when we think about exercise, people think that you have to do, yes, there is an optimal and an ideal amount, but every amount counts. And that's also an important thing.
Absolutely. I couldn't agree with you more.
Yeah. And I think sort of another question that came up in your book, and I've also read your other books, Dr. Topol, about deep medicine, is the intersection point of AI. And you've been one of the clearest voices in AI in medicine. Sort of where do you see AI? I think you allude to it in parts of your book, but what do you think is going to make the biggest impact, or is it going to be multi-domain, like diagnostics, discovery, drug discovery? Could you comment on that?
Yeah, I'm so glad you asked that, because this is actually an AI book, but people don't know it because there's no AI in the title. Because basically it's a way to prevent diseases, which we couldn't do without multimodal AI. So, we've had obviously electronic health record, and we have labs and images, but we haven't been using AI. So, for example, if somebody has lab tests, they look for the asterisk of what's abnormal, or their doctor does. And AI can look in the normal range and say, this pattern, may be the beginning of pancreatic cancer, for example. Then there's also images that can be interpreted by AI, such as the retina, as a gateway to every system in the body, predicting Alzheimer's, Parkinson's 5, 7 or more years before there's any symptoms. So we're not using the AI capabilities. But beyond that, for prevention, we as humans could not take all these layers, stack of data, the proteins, the genes, the biomarkers, the environmental exposures, on and on and on and on. We couldn't use all that data and make anything meaningful out of it. You could also throw sensors in there, which makes it even more complicated. But multimodal AI that's its greatest strength. And that's why we can say you are at high risk for let's say Alzheimer's, 15 years from now. So not just you're at high risk, but when. That we never could do before. And if we don't do anything, that's kind of what we're looking at. But guess what? We can do a lot of things. And we even have markers like p-tau217 that are modulatable, like LDL cholesterol for heart disease. We're not using this stuff. Now, for example, women get mammography, and they don't even know there's 2 FDA cleared or approved algorithms that with a normal mammogram, it still can report out a very high risk of breast cancer in the next 3 to 5 years. Now, as a woman undergoing mammography, wouldn't you want to know that? And most women have no idea. And this should be routine medical practice. These are really careful, rigorous studies. So there's lots of intersections with AI we're not using. The medical community and the public aren't aware of them. And we should be using, if we want to prevent diseases like cancer, Alzheimer's, and many others, we should be doing this. And so Super Agers is a cover, if you will, for let's use AI, let's use individualized data, identify high risk, and then with that temporal feature, not just high risk, yes or no, and many different orthogonal layers. So let's say you do a polygenic risk score, and it says high risk for some condition, could be one of the common cancers. Well, if you don't see that in all the other layers, you say, well, maybe that's just, an outlier. But you have orthogonal confirmation through these other layers to say, this is the real. And so rather than dissing one layer, we've got, many other ways to either confirm or refute or kind of modify our risk assessment. And everybody needs risk assessment. And we don't do that today. We have this dumbed down approach. Oh, well, if you're 50, you should have this screening test. Well, most people have no risk and they have a low yield. And as you both know, low probability before a test leads to all sorts of problems, mainly, false positives. And so we have got to do better in terms of assessing individualized risk and achieving individualized prevention.
To your point about earlier, the availability of tools now that can support prevention and longevity. You talk about AI, but also you talked about other tools that are recently discovered, not necessarily newly discovered. The use of GLP-1s, for example, and its impact on metabolic health and how it can be kind of a new tool as a protective drug, not just for weight loss, what was originally intended, or managing diabetes, what it was originally intended. How do you see using these tools like medications for prevention? And we know that we're seeing some medications that now have impact on preventing Alzheimer's even. So tell us more a little bit about these medications as tools for that.
Right. So just going back one step to the earlier question, AI can promote accuracy. It can be, as I wrote in Deep Medicine 6 years ago when it was published, it can foster more humanity in medicine for many reasons if you care to get into that. But to me, the biggest AI contribution going forward is going to be preventing diseases, which we've never been able to do. Now, what you're bringing up is a really good point, which is using drugs to prevent, not treat, but prevent. Okay, so right now we use GLP-1 drugs to treat obesity and some of its related complications like heart disease, liver disease, kidney disease. But we're also seeing it to help treat addiction, migraine headaches, autoimmune diseases like rheumatoid arthritis. And as you mentioned, there are 2 big trials with mild Alzheimer's disease, not prevention, but treatment, which are supposed to be out soon, called EVOKE and EVOKE Plus with Ozempic, placebo-controlled. So we'll learn about those. But even if they don't show prevention, treatment, we also should be considering GLP-1 drugs for prevention. Now, one of the misconceptions about these drugs, which have performed way beyond anyone's imagination, is that they have very potent anti-inflammatory effects in the brain and throughout the body. And that's one of the main reasons we're seeing all this diverse benefit that wasn't anticipated. And so we don't have a drug class that does this. And we hope to be able to exploit that. And we intend to test that in Alzheimer's prevention going forward, along with other candidates like lithium orotate, a supplement that's low cost that might be useful. And, many drugs that recent advances in life science suggest there's a possibility. I do think we're going to prevent Alzheimer's in the future. I'm really keen on that. And we're going to start the first prevention of Alzheimer's randomized trial early next year. And there really hasn't been one. So great opportunity there to prevent diseases. We're starting out with Alzheimer's.
I mean, even some of the vaccines, for example, Shingrix is a vaccine that there's a recent data, and you spoke about that before, about your own experience in making a decision about getting the vaccine for it.
I was reluctant to get the Shingrix, right? Because a lot of my colleagues said they had a horrible reaction and they were knocked out for 2 or 3 days. And I said, I can't do that. I had a hard enough time with the COVID boosters and shots. I didn't want to. They told me, this is much worse, Eric, much worse. Well, after these 3 natural experiments, and by the way, there's 2 more that are coming out soon, 5. This is like incredible to have a 25% reduction of dementia and Alzheimer's disease by getting a shingles vaccine. No less that you help prevent shingles, but you could get, if that was a drug, that would be considered one of the greatest breakthroughs in the history of Alzheimer's. So yes, I went ahead and got the vaccine because one thing is shingles, which is horrible. Another, which is even much worse, is having dementia. So I think this is striking. And again, it tells us about the immune system. This is not herpes zoster specific. This is about revving up the immune system in people who are older and who our immune systems are not quite as intact as when we were young.
But it does also point to new frontiers about, the science of virology and how the immune system is responding to these organisms as well.
Absolutely. There are other vaccines that have also helped not as convincingly as these natural experiments, but you're absolutely right. And I think someday we're going to have vaccines just to rev up immune system that are not necessarily virus or pathogen directed. Just, you see the immune system clock isn't working right, that your immune system age is much older than you. And you say, we better get this person a vaccine to get their immune system revved up. That's the future. We couldn't, in the clinic, we never could measure the immune system. We had nothing. We had the ratio of white cells to lymphocytes. What a joke. Here it is, 2025. We have no window in the clinic to measure the immune system, which is like the most important system in our body, right? And we are just about on the time when that's going to start. And immune system clocks will be the first foray into that. And there'll be many other ways to assess our immune system going forward.
It's important to highlight to our audience, this is not saying that medications are the way to go. If anything, it highlights the importance of lifestyle interventions, as you said earlier. But the discovery is that there will be tools available to improve these outcomes and chances and support, especially individuals who lifestyle is not enough to support their goals.
Exactly. I think lifestyle will help defer, but we need things to help not just defer, but absolutely prevent. And so that's why the first step is identifying high risk. And then, getting lifestyle on track, and then coming up with these other interventions that will help really knock down the chances of anyone getting a disease. Yeah.
Yeah, I thoroughly enjoyed your book, Eric, because there's a long, I think in chapter 7 about the Alzheimer's, the microglia, some of the rat Alzheimer models with a microbiome transplanted in non-Alzheimer's. But it just speaks to the interplay, like you mentioned, between the gut, brain, and the immune system, sort of as this, three-sided problem that we, really only looked at it from one side.
Yeah, this is, I think, something that is central, giving us this powerful way to change the natural history of a person's health. So, as you mentioned, the gut, we never would have thought the gut is such a big actor, but it talks to both the brain and the immune system. And going back to the GLP-1 drugs, this is, of course, how these drugs seem to have such a potent impact on both the brain and the immune system. But, of course, the other way is modulating the gut microbiome. So we're going to get better and better at that. So we're going to have two complementary ways of using the gut, whether it's the hormones or the bacteria and its metabolites, to change the brain and immune system reciprocal interactions. So this is really exciting. I used to say, I didn't used to say, but we always heard the adage about the way to a man's heart is through his stomach. And now I say the way to human health is through the gut, And the gut we're taking some big lessons from this gut. We learned first from the GLP-1s that are here and now. And by the way, there are another 10 more gut hormones besides just, Ozempic and Zepbound to use. And, ultimately in pill form, combinations. I mean, you start to get to endless possibilities. So people don't realize that we're only in the beginning of these gut hormone ways to achieve a salutary therapeutic effect. There's many more to come. And just think about the different combinations and the fact that they'll eventually largely be pills rather than injections someday. So we got a lot of exciting future here.
Yeah, and I think just because I think we're both fans of AI, I think do you think that AI will serve sort of like this education or tutor to bridge that gap we're seeing with the lack of trust in science? Because I think I love how you get down to the mechanistic, cellular, molecular levels, but I think what I've noticed is the attention span of the United States seems to going down. So how do we, how can we surface these these insights to people to make it understandable? Or could you comment how AI could help in that regard?
Yeah, well, I mean, AI is being leaned on to solve all our problems. You also can create lots of problems too. So I don't know that AI can fix this. The way people get information right now isn't ideal. A lot of it's by influencers who are not necessarily, experts in their field, who don't stick to evidence, who, have huge followings on TikTok or Instagram or wherever, YouTube. And this is a problem. The reason they're so successful is that because we have a basic rejection of the medical establishment. And they have these secrets that the doctors are not telling you. They have, take these peptides, don't take COVID vaccines, for example, or other vaccines. And because of this rejection, repudiation of the traditional medical community, they are flourishing. I don't know that AI can fix that. I think we have a really big challenge to reverse this. What I would hope is that we get all the medical community to stand up. And if they were active on various platforms and they weren't hiding or with their head down, we wouldn't be crowded out. Right now, we're terribly crowded out. We have like 1% of people like yourselves who are trying to get good word out. What about the other 99% of physicians and life scientists that don't? I understand they have better things to do with their time, but unfortunately, I think this is actually it's an imperative that we all weigh in and try to get truth, facts, data, real data, evidence out there. We don't have enough people that are standing up right now. It doesn't mean that they have to, go after directly the people that are, the anti-force. If we just had enough people that were standing up for the real evidence and facts. So, this book, I tried to stick to that in Super Agers and also project where we could go with validation and evidence and fact. It won't ever be as popular as some of the books written by people that don't, because, I'm viewed as medical establishment, and that's, what the hell is evidence? Facts. What's that? We don't need it. We can make stuff up. So we got a problem.
The hype factor.
Yeah. I mean, I realize that this challenge is quite formidable.
I appreciate you bringing the trust deficit challenge these days, and appreciate your efforts in perpetrating or expanding the evidence-based facts, because emotions are high nowadays, but facts are facts, and we cannot change those. And evidence is the best way to have a conversation with anyone and tell them we don't have any stakes in recommending a vaccine or a medication within the scope of practice. And that's I think where some of the public distrust is being exaggerated nowadays, is that there is this idea that healthcare professionals are benefiting directly from whatever we want to name it.
Yeah, no, it's really sad when in fact it's a lot of these influencers that are the ones who are actually benefiting with sponsorships. And the criteria for a sponsorship is a lot of followers, right? And that's unfortunately self-perpetuating. You put out misinformation or disinformation, you get lots of people, and then all of a sudden, you're getting paid for this.
Or misusing the data as well.
The other problem we have is I don't think in the history of this country, which is nearing like 250 years, have we ever had the leadership responsible for, active misinformation. It's really a nightmarish situation for us. And particularly ironic is that it's occurring at a time when we have such extraordinary opportunity to promote healthy aging, and having, medical resources being stripped and eroded. to support the research that's needed to take this over the goal line. So it's a tough time right now. We have to just, come up with ways to weather through it.
So we often, I know we can go for hours and hours speaking with you. So we often end our episode with a rapid fire question, and David has a couple of questions for you.
First question is one habit you won't skip after writing your book, Super Agers.
One habit I won't stop.
Yeah.
Well, I think the evidence about alcohol is concerning, but I still enjoy a glass of wine, so I won't completely stop drinking. Okay. I still think that it's something that helps encourage social engagement. I think it's good to keep it on a low end, but I won't stop. That's something that, it's hard to be too draconian here.
And I'll throw out one last quick question. Recently, there was some discussion about us reaching longevity escape velocity in this decade. Do you think that we're going to get there? As yes or no?
No. The idea you're coming up with is, of course, Ray Kurzweil and others saying that we're going to make so many discoveries that we're going to be ahead of the ability to, get longevity out there to, 150 years plus, whatever. I think it's absurd. We're not going to have escape velocity that I can foresee. I foresee, that we'll have artificial super intelligence and all sorts of other progress over many years ahead, but I don't see any escape velocity coming at all.
What's the most overhyped or misunderstood longevity idea today that you think?
I don't know that we're going to be able to reverse aging. That's what a lot of people are claiming. I hope so. That'd be great. But all these people that are advocating taking rapamycin, which has only been proven in rodents, or other things that are out there, getting total body MRIs and, things that are not proven. There's a lot of hype about things that are unproven and could be dangerous. Like, for example, the rapamycin thing is particularly concerning since some people at very low doses could have marked reduction of their immune system's functionality. And they don't know it because there's no way to measure the immune system until you get a bad infection or even put yourself at risk for cancer. And the fact that people are advocating this is really, and a lot of people are taking variable doses. That's really concerning. But there's a lot of things like that. I just use that as an example.
Well, Dr. Topol, today's conversation with you has certainly cut through the hype on longevity, on lifestyle medicine, on AI, on the hard work of rebuilding trust. We appreciate your time, and I cannot recommend enough this wonderful book, or we cannot recommend it. So we appreciate your hard work in spreading the word of evidence, and you spread it through science and storytelling both. And there's no better way to do that. So we thank you so much for joining us today.
Well, thank you both for what you're doing. And, purveyors of truth and evidence in medicine. We can't get enough of that. So thanks. It's been great to have a chance to have this conversation with you.
Thank you. Thank you for your time.
Thanks so much, Dr. Topol.
We thank everyone for joining us today. To all of you, we recommend that you check Dr. Topol's work, his ongoing writing for deeper dives. He has an amazing Substack newsletter, and you can find it on erictopol.substack.com, and his work through the Scripps Institute. Until next time, inward with courage, outward with compassion.
Thank you for joining the Well-Being Manifesto Podcast. Be sure to subscribe, like, and leave us a comment or review. To learn more about this discussion, visit thewellbeingmanifesto.com. And remember, inward with courage, outward with compassion.